not reflect the opinions of Comcast or its affiliates.
InnerQuest explores various pathways through which you can connect with the infinite wisdom of the universe and apply it to personal, professional, and spiritual growth. This program, featuring accomplished practitioners, educators, and authors, is provided by Infinity Foundation, an innovative center for holistic studies and research. We invite you to share this journey with us.
Hello, welcome to InnerQuest. My name is Jay Stone, your host for today, and our guest is Dr. Gregg Gerstin. Welcome, Dr. Gerstin.
Hey, how are you?
I'm fine, thank you. Is it okay if I call you Dr. Gregg?
It's perfect.
I am really looking forward to your interview. You've got a lot of information, a lot of valuable information. But let me tell the audience a little bit about your background first. Dr. Gregg is a board-certified chiropractic physician practicing in Northbrook, not far from the studio here, at Align Wellness Center. His focus in practice is on corrective postural care. He is one of only 20 doctors with a certification in chiropractic biophysics in the Chicagoland area to correct postural distortions. Well, let's start simply by defining chiropractic care to our audience.
Yeah, well, chiropractic can be very confusing because chiropractors do a wide variety of things. We're primarily a natural healthcare provider focusing in the spine and the nervous system and working to help it work the best that it can. Mm-hmm. Many chiropractors focus on the spine only, but some focus in nutrition, acupuncture, and other therapies as well.
And why would a is that something you do at your office?
In our office, we primarily focus on the spine and the nervous system, so we don't do the acupuncture.
Okay, so I won't ask you a question on that.
Great.
And so how do chiropractors help people?
So we work primarily with the spine and the nervous system to do natural therapies and take pressure primarily off of the spine and the nervous system. The body is pretty amazing, and there's one part of the body that controls and coordinates all the others. That's our brain. Mm-hmm. It tells every tissue, organ, and gland what to do. It tells our finger to move. It tells our stomach to digest food. Mm-hmm. It tells us to blink our eyes. And when there's misconnections, those things don't work quite right.
So there can be problems with digestion or even fatigue if, say, the message to the kidneys or adrenal glands are messed up.
Yeah, or multiple areas where there's messages not getting through can wind up causing the whole system just to slowly break down and cause you to get fatigued. And that usually happens before people get to a point of muscle distortion, weakness, or even pain. Mm-hmm. Okay.
And so what should potential clients or patients look for in themselves before they go to a chiropractor? What are some of the signs or symptoms?
Well, if someone's in pain, they definitely should go see one. Okay, but before you wind up getting there, you can wind up looking to see if your hips are off, your shoulders are off, your ears are off, because we're designed to be balanced from side to side. Mm-hmm. And if we're out of balance from side to side, it indicates that there's something just not right. Mm-hmm. Usually it winds up being that messages to a muscle might not be getting through clear. There may be some static on the line that's preventing it from working the best that it can, causing one side to work more than the other side, making it hard for those things to work.
Don't we naturally work one side more than the other? Like righties will tend to carry things in their right hand and lefties in their left hand.
Well, you may wind up carrying things on one side more than the other. However, the body's got a magical ability to balance out. There's been many studies done where folks have been casted on one side and they primarily worked out the other side and kept and maintained most of their strength on the other side. So our bodies are naturally made to work both-sidedly.
Okay. Now, you brought this wonderful prop, of the spine, and you started to explain it before the show, but please tell our audience what's going on here
So I brought a model that actually depicts what's inside and makes up the spine.
Okay.
So when we look at this little model here, we can see that this here is the bone, and this is another bone right below it. They're called vertebrae. And in between each of the bones is a jelly donut-like substance called the disc. And the disc has two main functions. One, it functions as a shock absorber, so we don't feel a step every time we make one. And then two, it works as a spacer to provide room for this yellow piece to come out. Now this yellow piece was that nerve that I was mentioning. And the distortions I was mentioning and talking about that can cause you to start to drift from health or make you feel less, not as good, can wind up being as simple as that. And many times we see it a little bit more exaggerated, looking like this.
When you say we see it, is it something you see with your naked eye or something on X-rays?
Yeah, typically we wind up having to look for these on X-rays. In terms of looking at them from the outside, I practiced for a while without looking at X-rays, and I'd have people bring their X-rays in, and I was very surprised at what I saw. So when I started seeing this, I started to realize this was something that was essential for practice, so that I wasn't guessing with the spine. And maybe we'll talk about a case later that I wouldn't have known what was going on inside had I not actually took the pictures of them.
Okay. Now, there's a progression of degeneration of the disc.
Yeah, we brought a couple that wind up showing what can happen if that misalignment is left alone. So as you can see here, we've got an ideal or normal, textbook normal spinal segment where the discs are nice and thick, the bones are nice and square, and the nerves that come out are nice and large. As those misalignments I mentioned earlier are left alone, they can wind up changing how the structures look to cause there to begin to be tearing of the discs, which can cause imbalances within the spine. We can wind up seeing disc bulges.
Well, talk a little about the tearing. Is this meant to be here?
Yeah, so this is meant to be here. However, it's not meant to have that little space there. That little space is a tearing of the disc that can happen from irregular wear and tear or misalignment.
Now, is that what doctors mean when they say a patient has a ruptured disc?
Not quite yet. So this one doesn't represent that, although this next one does represent it. And you can see that they've depicted the bulging disc on the side. Here is this red bulge here that looks inflamed.
Okay.
And as you can see, if we were to compare the side by side of how these nerves look, which one would you like to have?
Yeah, well, that's much bigger, and so more information could flow and probably be faster and more clear.
Exactly. So as we see these changes happening, on many people we wind up seeing dysfunction happen, but they may not have any pain whatsoever, or they might just have discomfort. They might feel stressed in their shoulders at the end of their day, or occasionally when they wind up working in the yard, they might have some problems with an episode of pain.
Now, is the same true for all of the disc in our spine? That's any one of these? So somebody could have a problem like this in the neck or the lower back or the midsection?
So most typically we see these types of breakdowns happening in the neck and the lower back. They're way more freely movable than the vertebrae in the middle, the thoracic spine. The thoracic spine have the ribs coming off the side, so they don't have quite as much motion, and they don't wind up breaking down or getting damaged as much. But that does happen.
Yeah, and did you finish this one and that one?
Well, and one of the other things we can see as we move along is that there's little ridges coming on the front of the bones here, and we can see it really significantly all the way over here. This is referred to as lipping and spurring, and it's a form of arthritis that develops in the spine when misalignments have been left alone for a prolonged period of time. It's the body's way of trying to stabilize. However, it winds up actually restricting motion and potentially causing more damage than good. Yeah.
Now, so what percentage of your patients actually come in looking like that, and that?
So I wish more would come in looking like this, because it's way easier to keep you looking like this than to try to help this move in this direction. Now, many of the people who do come and see us have areas that look like this, but they also have areas that look like some of these. So your whole spine doesn't have to shift or degenerate at the same rate. There are typical areas that wind up degenerating quicker than others.
And do you know why?
Well, typically they wind up being the load-bearing areas.
Okay.
So in the neck, you'll hear about it at the 5th, 6th, and 7th cervical vertebrae. That's kind of lower down in the neck. And in the lower back, we see it at the L4 L5, and S1 areas. And part of the reason that that winds up happening is that the spine is designed to have curves when we look at it from the side. And each of them should equal about 40 degrees. So in the cervical spine, we should have a nice C like this that equals 40 degrees. In the thoracic spine, it should also be 40 degrees. And then in the lumbar spine, it should be 40 degrees. However, most of it's all the way at the bottom.
And are you actually able to measure the degree of curvature?
Yeah, we are. In our office, we wind up using some digitizing technology that allows for us, on the images that we take, to put them into some software, and we can actually measure the individual segmental angles, because that's important too.
So the software actually, so it's an X-ray that goes, a digital X-ray that goes into your software, which
we wind up processing and we evaluate.
Do you show these images to your patients?
We do. Would you like to see one? We actually brought one from a patient that gave us permission.
Oh, sure, yeah.
All right. So this is one of our patients that came in.
I'll hold it, and you can speak, and I'll just watch it through
And this is actually a before and after picture. So right here, you'll wind up seeing the patient that came in earlier this year. And what we'll notice on the picture is that the green line indicates that ideal 40-degree curve that we had talked about. And the red line indicates the posterior, the back side of each of the vertebrae that we'd like to see. So it indicates right at about this point here, right at about that point there. And ideally, it should line up along the red line. Now, this is a patient who's had years of complaints of achiness and soreness, especially in the morning.
Female?
No, this is a male.
Okay.
He also had difficulty with sleeping, and those were his primary concerns, his achiness in the morning and difficulty with sleeping. We worked with him over a series of time, and over a series of time, we looked to reevaluate and to know where we've gone and what we've done. And you can see his reevaluation over here on the other side. And you can see that his head is shifted further back, closer to the green line.
It looks like his whole skull in the after picture is lit up.
Well, the image quality is a little bit different on each of them, so that has to do with the processing. We actually upgraded our X-ray machine through his care plan. So that's probably what the difference you're seeing in terms of the amount of white versus dark.
Yeah.
More than necessary.
Wow, it's a big difference.
Yeah. You know,
and I'm sure it costs a pretty penny to do that.
Well, you know, cost in terms of this, the technology is really advanced, so to me it's an essential to have so we can properly evaluate patients.
And so what is this patient reporting now?
So he shared with us that he's getting out of bed easier, and he's sleeping through the night fully.
And can you state the age of this patient?
I believe that he is, I want to say that he's 62.
Okay. Excellent.
Yeah.
Now, do you ever work with patients like just right before surgery or after they've had back surgery?
For sure we do. You know, whether it's someone before surgery, and actually surgeons are realizing how important those curves are. And when they're doing their surgeries, if there's a fusion going on, they're looking to restore those segments that they fuse to these angles so that there can be better integrity of the spine. So we work with people before they've gone to surgery. We work with people if they've been through a surgery and are having symptoms again, and that's a common thing that we see in our practice. Patients who have either been to other doctors, medical doctors, chiropractors, or other healthcare professionals and have problems, whether they were neck or lower back, and they were treated and they just didn't have success, or they had success for a period of time and then their symptoms came back.
And why is it? Why do people have success and then symptoms come back? Is it because of re-injury or just some habitual bad habit of sitting or standing?
So there's kind of two reasons. Definitely a re-injury can wind up making it happen. So for example, someone who is in a car accident can get symptoms again, and that's primarily because the structures can change within the spine. Someone who's doing their regular life and doesn't involve high impact, like a football player or anything like that, and the symptoms wind up coming back again, it's typically because the cause of the problem wasn't fully fixed. So those changes that we saw in those X-rays weren't necessarily corrected. And that's one of the main reasons why that's a focus of our practice.
And if somebody's feeling healthy, how often do you recommend they visit a chiropractor?
It all depends on the individual. It really does. I wish that there was a catch-all or fix-all in terms of the frequency that you need to be checked by a chiropractor. But I've seen patients who are active and don't have really any complaints. However, their spines really don't look good. And someone can periodically get a checkup and it'll help them to feel better or more better versus not necessarily noticing the symptoms. But eventually it winds up coming back and catching up with you. And we see many of our patients in their 50s and 60s who have noticed that achy soreness and just not done much about it, or maybe got a massage or took Advil for it. And then all of a sudden it catches up with them. And it kind of is like the straw that broke the camel's back. It's sort of the last step that's wound up breaking things down. And a lot of it has to do with those changes that have been developing, as we saw in the models, for years. And we've just been taking care of the symptoms, which is the tip of the iceberg. So how we feel is about 10% of what's going on. Another 45% tell our muscles what to do. And another 45% of the nerves tell our organs, blood vessels, and glands what to do. So if we just wind up listening to the how we feel portion, we could be missing a lot of what's going on.
Yeah. Well, how do you tune into those other communications going on?
It's a great question, but listening.
Yeah.
You can listen just by understanding symptoms, or if you notice that you're having changes in your digestive system, changes in how you're breathing, changes with headaches or migraines. For women, they can notice that their cycles changed, or maybe it was painful all the way from the beginning, and they've been medically managing it with things like birth control or something else to help the symptoms go away.
Okay.
Additionally, there are tests that we do in our office to be thorough and complete, where we actually look to judge muscle function at a subclinical level. So you may be able to, lift your arms up and there's no problems, but when there's light resistance put on some of them, they don't quite respond as quickly as they should. And when we wind up seeing that, if we change positions and it goes back to strong, that tells us that there might be some changes going on under the surface.
So is that muscle testing?
Yeah, we do some muscle testing as a part of our exam.
Now, you're not the only chiropractor in your practice. How does the work you do complement the other chiropractors in the office and vice versa? So
as you mentioned at the beginning, one of the things that has helped build our practice and help me to understand this was studying a technique called chiropractic biophysics. It's one of the only techniques in chiropractic that has over 150 peer-reviewed journal articles out there in the literature. And these aren't jokey articles or literature. This is in places like Spine, the European Journal of Rehabilitation, and some pretty high-quality journals. And for us, we all are certified in it. So we've got 2 doctors who are certified in it and a 3rd doctor that's working on their certification.
What does it take to get certification?
Well, there's actually 2 levels of certification. So for the basic certification, which 2 of us have in the office, it takes about 150 continuing ed hours of study. It also takes a written exam as well as a practical exam to wind up receiving that.
In the practical exam, you actually have to work on a patient? Or?
Yeah, you do. You have to work on cases and patients, and they test that you know what you're doing. One of our doctors has completed or is about to complete his advanced certification, which requires another 100 continuing ed hours and more advanced studies. And then you have to write up a study. So he'll be presenting his study next month, actually.
Like a case study of one particular patient?
His is actually a study on ergonomics and eye movement at the desk. So he'll be presenting that next month.
That sounds very interesting. And poor eye movements, that can create neck and shoulder and back pain?
Without a doubt, yeah. Desk position can affect how you wind up working, although I find it's not the dictator of it. So your desk doesn't make things change or break down. You usually make them break down, and then you're in a poor environment of your desk for a long period of time. So as much as we think changing our desk will fix that problem we've had,
now,
it's not always
it's been
the answer.
said like working 8 hours a day at a desk is like smoking a pack of cigarettes. Do you have any ergonomics suggestions?
We do, and on our website and on our Facebook page, we've wound up sharing some of the best. Actually, just last week, I shared a great post on it that consolidates it. But there's a really fantastic way that you should wind up sitting at your desk and having your office space situated so that Your
I got to
desk.
go back to your website.
Yeah.
What about these like computer monitors where you can pop them up now and stand and work? Do you have opinion on those?
You know, my opinion is still out, okay? There's a lot of people who are big fans of them, and I love to, you know, I always ask for some support. I've only read one study on it that actually measured before and afterwards standing time versus sitting time. And the one study that I read, when they measured the time that people were standing or sitting in and out of the desk, so they actually put like pedometers on them, measured them all the time, and then saw what changes happened, said that the people who were at their sitting desk before they introduced the standing desk stood more outside of work. And then when they put them in standing desks, they wound up sitting more outside of work.
Yeah.
So where the idea sounds really awesome, I look forward to seeing more of the information that says that it correlates.
All right. I would like to get to this. Tell me what we're looking at here. And
So now this is a process that we help to share with our patients to understand what they'll go through in our office. And one of the big things that makes us different than many other offices is that many people come in with segments that are misaligned, putting pressure on nerves, making them not feel great or look like these two guys. And as we work with them, in most cases, in a short period of time, we see that we pass through that pain line we see right here. And what happens at that point is that we've barely taken the pressure off of the nerve, so that nerve can send messages freely and you can feel better. Primarily releases that 10% of the pain nerve.
How would you make that change to take the pressure off that?
One of the most important tools in our office is the chiropractic adjustment.
Okay.
And that's a gentle force that we use within the spine.
Is it just your hands, or you use, I've seen chiropractors use some other things?
Yeah, in our office we use our hands, we use tools, we have tables that go up and down, and we find what works best for the patient. So there's no one way that works for everyone, but we have a variety of different tools so that we can fit the right tool with the right person.
Okay.
As we're working with many of our patients, they wind up getting out of pain, and where chiropractic programs are amazing in doing that, for many other people, that's where a million other things wind up becoming a priority once they start to feel better. However, once they start to feel better, many of them find themselves falling back into this little dip here, and that's where the symptoms start to come back, and where many other forms of care, whether it's chiropractic and or other therapies, don't necessarily take care of the cause of the problem. With our patients, we guide them to continue to work on correcting those curves and take them through to making a correction take place so that the spine is off the nerve, and then help them into life with healing activities and activities outside of their office that can complement the work that we do here.
And what would some of those healing activities be?
Well, we always encourage people to be active and involved in an exercise program that suits them.
Okay.
You know, and that varies.
Okay, from walking to yoga. Now, last chiropractor I interviewed, she was not. She was very anti-yoga.
Yoga is such a wide practice, right?
Yeah.
You know, so there's so many different spectrums of yoga, and some are great, and some are less good, and some are less good for certain people and great for other people. You know, my wife, she loves hot Bikram yoga. And you know, I've done it with her, and I'm not sure that I love it as the best activity for most people. You get dehydrated, you do stationary motions. So I'm not sure that I think of it as the best type of yoga, let alone activity. But I'm a big fan of very flowing yoga, vinyasas, motion in your yoga and connecting it with your breathing. And I think that in most cases, it's really great.
Excellent. Any other exercise like bicycling, weightlifting?
You know, I think they're all individual specific. So, you know, for our 62-year-old patient, well, we might not be getting them into some of the boot camps or CrossFit or those sorts of things, but there's definitely a level of activity that winds up being outstanding for them. Whereas our 27-year-olds, getting them into those high-level activities will really help them for the long term and helping them to build bone for life.
Well, Dr. Gregg, you're so passionate about chiropractic and helping people. How did you ever get started on this path?
You know, it was a personal experience for me. When I went to undergraduate, I went to the University of Michigan. And when I moved from Atlanta, where I grew up, I had horrible allergy problems. Never had them before. And wisely, as a 17-year-old, I thought nothing of it. But every time I was on the phone with my mom, she told me to go to the health centers. And they put me on a Claritin D and an antibiotic. I'd do that for 2 weeks, and then it would all come back. So I did a dance like that for about 3 months. And my mom called my doctor in Atlanta. He put me on a long-term prescription of Claritin D and said, we'll figure it out when you settle down. Meanwhile, fast forward to the middle of my sophomore year, I was working as an athletic trainer with the track and field teams, and I forgot to take my Claritin D. By the end of the first day being outside, my sinuses were all gunked up. I was having sneezing fits. And the team coaches told me to go home. Team chiropractor said he thought he can help, and he invited me into his office Monday to get checked. What he told me was that I had some misalignments here in the top of my neck that were affecting my immune system, and it was preventing me from reacting to the environment as well as I could. We started working together, and within a couple of weeks, my sinuses cleared, and within a couple of months, I was off the medication. I said to myself, what's going on here? There's got to be more to it, and just started to learn more. Shifted my major. What
was your major before you?
Well, so it was real close and similar, but I needed to take my prerequisites. So I was studying motor control and biomechanics in the Division of Kinesiology at the University of Michigan. So I shifted my focus into the pre-med requirements. And then when I got into chiropractic school, I actually focused and studied the chiropractic biophysics technique that we're using now, but I went through a drifting process in learning to practice.
And do you ever have problems with your sinuses anymore?
Not when I'm getting cared for, no.
Okay. And most people, including me, that don't know about chiropractic and the spine wouldn't think an autoimmune problem such as allergies can be cured with a spinal adjustment.
Yeah, I was with you as well.
Yeah.
And as I got introduced to it, it just made sense. When there's stress and pressure on the nerves that talk to the immune system, it's going to overreact.
Does the team chiropractor know how he changed your life?
We've talked a bit since, yeah.
Yeah, that's awesome. So what are some of the other conditions that chiropractors help correct?
Well, some of the most common ones are neck pain and lower back pain, carpal tunnel syndrome, headaches.
Carpal tunnel, that's related to the hands?
Yeah, it's related to the hands and wrists.
Just getting assigned 2 minutes. What can a chiropractor do to help the hands and the wrists?
Well, in most cases that I've found, there's usually something that's called a double crush syndrome that's occurring. So it's not always just a problem right here in the carpal tunnel, okay? But that's sort of the last straw that breaks the camel's back. But there may be an impingement here, here, and here that finally says, enough, we're stopping you, and we're getting louder till you do something about it. And that's one of the reasons why so many people have it bilaterally, is because it's less out here and more up here. So when we wind up looking at the spine and determining exactly where the breakdowns are, we can figure out how do we unravel and undo them.
And how long does it take you to treat carpal tunnel?
Well, every case is different.
Yeah.
As we saw in the case that we shared earlier, he looks a lot better, but he's not at the ideal. So we still have work to do for him.
Sure.
So I wish there was a cookie cutter that I could outline for you, but every case.
And do you work with people like post-surgery, post-carpal tunnel surgery?
Yeah, we do, as well as we work with many medical doctors. So we have medical doctors that when they don't have an answer or can't figure it out, they send their patients to us, and we usually do. And it vice versa goes the same way.
Well, Dr. Gregg, I got to stop you because we're out of time. Oh, wow. And we probably got through like 1/10 of the information that we prepared for. For more information about Dr. Gregg, Infinity Foundation, or Quest Talk Show, stay tuned to the credits at the end. Until next time, wish you good health, good fortune, and good spirits. It's been a real pleasure, Dr. Gregg.
Thank you for having me.
For more information about this show, our guest, Infinity Foundation, or any of our other programs, please visit our website, infinityfoundation.org, or call us at 847-831